What's up guys, it's Dr. Aaron McEnley here with Revival Performance Physical Therapy, and today I'm going to be showing you guys what's called a segmental hip bridge. So same as a normal hip bridge, but you're going segment by segment, kind of rolling that tailbone up while you're going up. So this is good if you're having some low back pain and you keep on trying to use your low back instead of using your glutes to lift up and keeping that core tight. So everything else is the same setup, so go ahead and get onto your back, just like this. Laying on your back, your knees are going to be bent, kind of close to your bottom, but they don't have to be like touching your bottom, but you don't really want them way out here either. So knees about comfortable bent, just like that. You can also do this with a band. If we tell you this, actually the band really does help focus on the glutes so that you don't actually accidentally use your hamstrings too much or use your low back too much. So, but I'm just going to show it without it, but same concept with the band. So you'd be pushing the band out, then tightening your pelvic floor muscles, like rolling in your P, and your abdominal muscles, and then you're rolling your butt up, so that posterior pelvic tilt, and then you're controlling that, so these muscles are still going on, and then you're just rolling it up. You go as far as you feel like you can without letting this happen. See how there I lost my control of my core, and I started to use my low back. So you control that up. You should not feel it in your low back. You just feel it in your core and your butt. On the way back down, it's the same, it's the opposite. You're rolling from here to here, segment by segment, rolling back down there, and then same thing going back up. So you roll it up, segment by segment, tailbone comes off first, roll up to about mid-back, butt squeezed real tight, core squeezed real tight, and then rolling it back down. So it should be a little bit of like almost like a little massage on your back, because it kind of squishes it down and then stretches it out a little bit, feeling that in the core and the butt. Pushing out on the knees so that you're not getting that hamstring cramp. If you do get the hamstring cramp, think about pushing your feet away from you. They're not actually moving, but it's like I'm trying to push like this. So it's going to put a little more pressure on your shoulders, but that'll take some of the stress off your hamstrings and put a little bit more on your quads and your glutes. So tucking that tail, rolling it up, rolling it back down. Do the prescribed amount, have fun.